Welcome to another episode of the Voice of Viet Vegas. I hope you, the audience, are all doing well. Under the current lockdown, we are not able to have a guest coming to our studio as we usually do. However, I want you to know that we will continue to do our part and we won't stop looking for new opportunity, the new way to deliver you the show, even in this challenging time. The corona pandemic has thrust our community into unknown territory. We recognize this is a frightening time and that many in our community have faced both health and economic impacts. Hopefully, our guest today will offer you some useful information to help you to cope better with our daily life during this challenging time. Dr. Gregory Brown is an associate professor of psychiatry and the residency training program director at the University of Nevada, Las Vegas School of Medicine. Dr. Brown founded the psychiatry residency training program and has been the residency training director since the time of the first entering class in 2004. Please welcome Dr. Brown.
Well, thank you so very much.
We talked about the other day, and basically that I wanted to use this opportunity to helping the people who are basically very frightening, and sometimes they lose sleep over something that we shouldn't be too much worried about it. But in any ways, the first question I wanted to ask you is that. As a physician, as a scientist, if you could tell us exactly, in summary, that what exactly is coronavirus and how are we protecting ourselves or trying to not to worry about it and, find ways to help ourselves to live a normal life during this, challenging time.
Well, that's a big question. The first thing I'll just say as a matter of course is I'm not a virologist or an epidemiologist. So
I understand that. Right.
So there may be some knowledge limitations, but basically this is a virus like many other viruses, and it's in the same family as the virus for the common cold. Now it has had more severe relatives, brothers and sisters of the virus as well, which have been more severe in the past than the common cold, and this is one of those, which is obviously more severe than the common cold for sure. But it's in that general family of viruses, and it is probably, from what we can generally tell, a seasonal virus. It started moving into the southern hemisphere as the southern hemisphere is getting colder. And we can probably, according to the CDC, expect to see it come back this fall when it gets colder here. The original fears, though, were that there were going to be hundreds of thousands or maybe even millions of deaths from this condition. And this was based upon initial numbers that came out of China, Italy, and Spain in the early parts of their epidemics. And so when it got here, we took some very reasonable precautions, I think, especially in Nevada at the beginning. We had social distancing, we closed some businesses, and we tried to flatten our curve so that the emergency rooms, the intensive care units, and the respirator needs of the community would not be exceeded. And we successfully did that. Our curve flattened out on around April the 8th, which is almost a month ago now. And our overall numbers, our overall deaths, our overall intensive care unit usage has been dropping since April the 8th, and it continues to drop right now. So that's all wonderful. The other really good thing that I hope helps people worry a little bit less is that I know that a large percentage of the U.S. population believes if you test positive for this condition that you're going to die. And the fact is, you're probably not going to die. Testing positive does not even mean that you're going to have to go to the hospital. And more than half the people who test positive have no symptoms at all. So those people are having a normal immune system, fighting this condition, getting it to go away, making themselves no longer infectious to others, and they don't even know they're sick. So probably somewhere between 0.1 and 0.5% of people will end up dying from this condition, but it's a very small number compared to what we were worried about before. So you don't have to be terrified or worried if you know someone who has it, even if you've tested positive. Take care of yourself, get well. Your immune system, unless you have a lot of complications and other risk factors, the odds are very good that your immune system will take care of it, and you'll be feeling much better within a couple of weeks.
Well, on that note, I think that the data shows that we are so scared for very little things, and based on the data that we receive, basically in Italy, 99% of the people who are dead from the virus actually have underlying illness. So, and basically those people who have some illness prior to, and those are very serious illness. So based on that information, I think that I shouldn't be blaming anyone, but the information's come to us, and they probably exaggerating it. And even hospital is basically some, and I don't know if it is true or not, but some that they say that if someone died in the hospital, and if you can probably state it that was related to coronavirus, you may get some additional assistance financially. So I don't know if it is true or not, but what is your opinions on that?
Well, I think we probably have some overcount, because in some emergency rooms, when they don't have enough tests, or hospitals when they don't have enough tests, if someone has all of the symptoms and they're going to admit them to the intensive care unit, and they're going to treat them the same way they would treat them if they had COVID, they will diagnose it as COVID without a blood test to do so. So in that particular area, you're exactly right. There is an overcount, but we don't know how much the overcount is. But since we cannot get community-wide testing that gives us a sense of what the rate is in the entire community, there's probably also an undercount at the same time, because we have no way of identifying people who have no symptoms. So in some areas we're overcounting, in some areas we're undercounting. But you are 100% right that when we only test the people who are the most sick, and we only count the people who we already know to be sick, what their death rate is, we get a very exaggerated risk profile that's put out to the community. I don't know that it's purposeful, but because we can't get full community-wide testing, we are getting overestimates of death rates. And that's just a sampling error that's part of the statistics.
What about the underlying serious illness, according to the data from Italy?
Well, that's also true in America. When we looked at the hospital rates in New York City, 90% of people had other significant illnesses, and who died of COVID had 90% illnesses. So that is a factor here as well. The illnesses we know are most related are obviously immunosuppression for whatever reason, high blood pressure, diabetes type 2, and obesity, and of course age correlates as well. So those would be the major conditions that would mostly contribute to death.
So would you say that depending on the area, for example, like in New York City, the death rate is 16 times more than California, and basically yeah. California have more populations than New York City, but New York City has 16 times more death comparing to California. People saying that because California is basically better prepared. I don't think it is true though. What is your take on that?
I think there are several factors that probably go into that, and more are being discovered every day. So this is not a complete discussion, but one of the factors in New York City is that people are packed together much more tightly. So if you have someone, for example, in an apartment complex that catches it, they're going to be more likely to be able to spread it within the complex than in California, where things are more spread out. Public transportation in New York City is known for being very crowded, especially subway systems, because they're efficient ways of getting people to work. But if you're crowding hundreds of people into a small subway car, it's going to spread much more easily in that circumstance. So I think there are a number of factors. The other article that I read on this talked about, it looked like California had gotten a version of the COVID-19 virus, probably from Asia, probably China. However, it looked like New York City got its cases of COVID from Europe as a primary infection source. And it is looking like there may be some mutations between those two strains of the virus that may make the strain that hit the East Coast be a little bit more problematic than the strain that hit the West Coast. That's preliminary information, but it has been published that it looks like the illness rates of morbidity or mortality are different East Coast versus West Coast.
Right. And basically that I also read some of the articles, and some epidemiologists, I couldn't pronounce this one, virologists are advising that most of the practical course of actions to manage the infections while allowing so-called herd immunities to build. What is your take on this?
Well, we have to build herd immunity, and there are two ways to do that. One of those is to allow more generally healthy people to get exposed to the virus so that they themselves get immunity, and then they can no longer spread it to other people. The other way to get herd immunity is to have vaccinations, which then also create individual immunity after you've had the vaccine. And you need a certain percentage of the population to be immune one way or the other. And then once that level of herd immunity is reached, the thought is that those people can't spread it anymore. So when it comes back around later, it won't affect society so badly. The people, the virologists are saying the question is whether we can be immune for a year, 2 years, 5 years. No one thinks we're going to be immune lifetime, but even if we can get a year's personal immunity that goes into herd immunity, we will be very well protected this fall. If we're too protectionistic, though, and we keep too many people from getting the illness, especially since half the people don't know they have it, if we're too protectionistic and we don't let it spread enough into non-risk layers of community, then we're not going to get herd immunity. And when it does likely come back in November, December, we will have, really substantially, people who are very ill, and we could be in a situation of having to close the economy down again, which would be devastating, potentially for the next generation to keep up with.
Right. Wow. So there is another issue on this, that if you are receiving the virus and then you get well again, in the beginning they said that you get immune to it, but now they are reversing the idea. So exactly what happened? I mean, if people already receiving the virus and then they get cured, or they get well again, so can they still get it again?
Well, that is a giant question. There are people who have been declared cured from the virus because they had 2 days of negative test, and then later got sick again, and then got a positive test again. So the giant question for the world right now is, did these people, are there a select group of people who don't develop the kind of robust immunity they need to fight it off? And is it because it's going to take their bodies longer to develop the immunity? Is it a different type of immunity that they need, not just antibodies alone? That's the first level question. We don't have an answer to that question. But there's another factor that people have been ignoring in this debate, and that is the test where they do the nasal swab and jam it in your nose. They get the test and then they send it off. That test currently has a built-in false negative rate at 30%. So that means that if you get this test and the doctor calls and said you're negative, 30 out of 100 people will actually still have the illness, but the test is falsely saying they're negative. And so at least some percentage of these people who are saying they're clean, they don't have it, and then it comes back, probably part of that just relates to the false negative rate on the test that we're using in the community right now. There's no way to fix the false negative rate with this test. Maybe we can get better tests in the future that will have a lower false negative rate, but all medical tests have false positive and false negative rates. This is a high false negative rate. So a lot of people who've been told you're well, you're cured, you're over it, simply have a test result that says they're negative even when they're actually still positive. That's the simplest way to explain most of these cases. And if you just do the math, you could do 2 tests in a row, test negative twice, and 9 out of 100 people will still have it. And then, because each time you have a 30% chance. So even after 4 tests, you still have nearly, I think, a 1% chance out of 100 of being positive for the illness in spite of 4 negative tests in a row. And that's just built into the test. I can't say that's the reason everybody got symptoms again or that everybody was positive again, but that is a really powerful explanatory model as to why many people got it again. I think to say people are not going to get immunity is a major reach beyond what the data says.
Well, before I ask you the next question, I just wanted to say this. Myself and Dr. Brown, we met several years ago in a conference for a mastermind conference. And then later on, we happened to become one of another membership of another mastermind. And I am so impressed the way that the information and the knowledge of the doctor. So he gave me one of this book, and we are basically now is actually in the mode that we eat a lot, and sometimes that we shouldn't do. But since we don't have anything to do, we probably have a tendency of eating a lot. So he gave me a copy of this book, and it is one of the bestseller book on Amazon. So it is The New Mind, New Body, the Inner Makeover for a New You. So if any one of you wanted to try and have felt many times that how to become thinner, so you should read this book. Just go to Amazon and probably just type Gregory Brown, MD, or The New Mind, New Body. You will find it is very interesting book to read, especially this time. So
well, thank you, Tuan. I had no idea you were going to do that, but thank you very much.
Well, I think I'm so amazed with the way, and then we have a chance. Another thing too, we got a chance to teach a few workshops at the casinos here in town and some other casinos out of town. But it is an honor for me to work with you and having those workshops that provided to the casino people. Anyway,
happy to do it. Thank you.
Well, thank you so much, Dr. Brown. So this is actually going to your territory, which is psychology. As you know that people in this time, very challenging time, they suffering loss of income, loss of job, and even loss of family member. So as a psychiatrist, what would you advise people to resume to a normal life, if you may?
Well, the first thing I would just say is there's a pretty amazing area of study out there that's been around since probably the 1980s, It's called psychoneuroimmunology. And it's a science-heavy field, but basically, if we want to boil it down to the bare roots of it, it says that when you feel stress, and increased stress especially, the stress releases chemicals into your body, and those chemicals actually make your immune system less effective. So I realize that the stresses out there are very real. The loss of paychecks is terrible. The lack of support is terrible. The total unknowing of the situation is terrible, because we don't know when things are going to approach normal again, if normal is what normal was. But even though those are real stresses and they bear down on all of us every day, it's still true that we can take a little bit of control over that stress. And even though the stress is real out there, we can take a little bit of control over how we respond to the stress. Because if we practice some basic like meditation exercises, relaxation exercises, things that slow us down, take us out of that stress mode, it helps our bodies build a stronger immune system. It helps our bodies fight off all kinds of illness, including this one. And it helps us be more healthy and balanced, even in the context of uncertain life circumstances. So what I would recommend to anyone, if you haven't started yet or you don't know yet, look up some basic meditation practices, some basic relaxation exercises. There are hundreds of people giving examples of that online, and you can follow through. The simplest meditation exercise I can just share really quickly, and that is find a comfortable place to sit where your feet can be flat on the floor and your arms are in a comfortable position. Close your eyes and just say, every time you breathe in your mind, say the breath flows in. Every time you breathe out, say to yourself internally, the breath flows out. Do this for 15 minutes. Now, your brain is going to start to like say, oh, I need to go shopping today, or I need to do this or that, or I check this ad online or whatever. That's okay. Just bring your focus back onto the breath flows in, the breath flows out. And as you do that, you'll find your body starting to just go into a little bit more relaxed state. Your muscles will loosen up a little bit, and you'll take yourself out of that fight, flight, stress response. And doing this 15 minutes every day is a great practice for your body, your mind, and your spirit to get yourself more focused and ramp up your immune system, and also just feel more relaxed. I think that's one of the most important things people can do right now, is learn a relaxation techniques. If you don't like that one, find another one, but find one that you really like and that you can do regularly.
That's what I call that the best of the best. I'm talking about you integrating the Western medicine to the Eastern medicine, and those meditations has been around for thousands and thousands.
Probably so, yes.
Thousands of years. And I think that is, you don't need any medications. You probably just, using some of the technique that has been around to calm you down, and that, help you a lot. Again, thank you so much, Dr. Brown.
And it's built in, it's
Sure.
Free, and you can breathe anytime you want to.
All right, thank you so much. I think that we keep saying this before the pandemic came around, and we normally have a dinner together, once in a while. The two families, Alicia and Dr. Brown and myself and Kim too, had dinners and discuss things. And we haven't done it for a little while, so hopefully that after this thing is over, we need to resume that. And again,
would enjoy that very much. Let's get it on calendar.
All right, sure. Again, thank you so much, Dr. Brown, and I hope you do well. And I hope that next time we're seeing each other, I want you to come to the studio, giving the community some helpful hint and, so some of the experience that you have helped the others. Thank you. Thank you so much.
I would be honored to. Thank you.
Thank you. Again, we'll see you the next time. And I hope all of our viewers We'll continue to support our shows, and I look forward to see you the next time. Thank you so much.